It's not necessarily what you do, it's why you do it, especially when it comes to your health. That is what today's Healthy Dose of Spice is all about. So, if this is the first time that you're catching one of my videos, welcome. My name is Dr. Alex Rosa. I'm the founder and creator of Spice and the 90-Day Metabolic Makeover, and I'm an expert in all things intermittent fasting and metabolic health. And I really want to dial in today on the why and why the why is so important, especially when it comes to your health. And when you find yourself jumping back in, jumping back out, starting, stopping, never finishing, never committing, never staying disciplined, just never really following through. Why, when it comes to your health, you are in 10 different Facebook groups and you've been in 10 different Facebook groups for intermittent fasting and high blood pressure and weight loss and low carb and high protein and all the things and menopause and hormones. And you've been in these groups for like 10 years and you still have the same problems. And so there's a common denominator there. And I'm just going to focus on one part of it, which is the why. And I'm going to illustrate this with an example. And this is an example that you can apply to your health, your life, your business, your career, to all of these areas. And it's really going to be life changing. So pay attention. So, in a group coaching session that we had this week, our mentor played a video for us. And the topic of conversation, like our assignment for this week, was to really dive into the why behind our business and to get really clear on that. And so she shared with us this video that was a really great illustration of why this is so important. So if you want the link to this video, just let me know. But in this video, it's a comic, and part of the comic's show is that he interacts with the audience. So he picked somebody in the audience and he says, hey, sir, what do you do? And the gentleman said that he is a singer or a choir director, something to that effect. And the comic said, well, that's great. He goes, could you sing us Amazing Grace? So they gave him a microphone, and the guy just sat in his seat in the middle of the auditorium and started singing Amazing Grace. There's like hundreds of people around, and he just started singing Amazing Grace. He had a great voice, beautiful voice, sang it nicely. I mean, the guy could sing. And when he got done, everybody gave him his round of applause and all that. And so the comic goes, thank you. Thank you for that. That was beautiful. He goes, I want you to sing that same song. He goes, but I want you to pretend that your uncle just got shot and he dead, and now you're at the funeral. Now sing Amazing Grace. So same song, same request, same person, same everything, same environment. The guy picks up the microphone, still sitting in his seat, didn't get up, didn't do nothing. And did he sang that song? He didn't just sing that song, he sang that song. And again, the same song, same request, same person, same environment, same microphone, no music, nothing. By the time he got done with that song, he had the whole auditorium, everybody standing up. People are crying. People are just like on their feet clapping. By the time he got done with like the last note and he was done doing his little runs and stuff, I mean, people were coming up and giving him high fives and hugging him, and, just people in the audience crying. And even the comic was like, what the fuck just happened? Like, he couldn't believe it either. It was so powerful. And it simply was because he knew the why behind why he was singing, why behind what he did. We knew he was a singer, but when the why was so powerful behind it, it changed the entire delivery, the entire emotion, the entire experience behind just that simple request of singing Amazing Grace. So this is what I submit to you. How can you apply this to your health, to things that you have going on inside of your body that are a concern for you, a new diagnosis, a chronic disease, some pandemic weight that you just can't seem to get off, hormonal issues that are just really interfering with your life and your business and your career? Why have you tried to do this so many times, but fallen off the wagon, not staying disciplined, started here, stopped here, keep jumping from program to program, not really finding anything that's fitting with you and helping you to establish those really long-lasting habits, routines, that lifestyle change that you know that you need to make, but can't seem to just get a hold on? Why? Why does it seem like it's an ongoing, never-ending process? Why does it make you feel like there's something wrong with you? That no matter what you try, nothing ever works, and maybe you just kind of gave up and just assumed that you are a lost cause. So that's what I submit to you today. Think about the why behind you're doing what you do, what you want to do. Why do you really want to do this? What is the deeper reason? Because so often we come up with these very surface level reasons why we want to do something. And then we wonder why we only get surface level results. We don't really get the deep, long lasting healing results that we are looking for because, again, we are not really going deep enough. And with traditional healthcare, most healthcare practitioners, there are some out there, I'm one of them, most healthcare practitioners are not taking the time to really get into a relationship with you, a dialogue with you, and really help you to discover your why of why you're doing something. But there are some, like I said, like me, that take the time, that are really trying to change the whole landscape of healthcare and the relationships between healthcare providers and patients, how you can really apply, like why this is necessary for your life and why you need to make changes like now. Like waiting till New Year's Day is not really the best situation, right? And so many people do this, but really your body don't know when it's January 1st. Your body don't know when it's New Year's Day. Your body's not going to be like, oh, hey, let me not, have this massive heart attack because, oh, she's going to change everything on January 1st. Your body doesn't work like that. Your body only knows the years and years of abuse and stress and trauma that it has been under because of the lifestyle that you have been leading. And when you can really find a practitioner that works well with you, that can really help you to dive in a little bit deeper into that. And I'm not talking about therapy. This is not like therapy. I'm talking about looking at your childhood. And so, like, one of the assessments that I run through with my clients is called ACE, Adverse Childhood Experiences. And this is a free thing. You can Google it or you can ask me. I can send it to you. It's a free thing. Anybody can do this, but it's one of the things that I run through because it is so incredibly powerful how accurate this assessment is. It's called Adverse Childhood Experiences. And all it does is it asks you a series of questions, and it looks at things like abuse. It looks like physical abuse, sexual abuse, emotional abuse. It looks at trauma. It looks at socioeconomic status, food poverty, scarcity, incarceration. Did your parents stay married? Did they divorce? Familial, situations. It looks at all of that. And it is an amazing predictor of when you get to adulthood, what is your risk factor for developing certain types of health conditions like diabetes, like high blood pressure, like anxiety, depression, asthma, cancer. There's so many. And it is scarily accurate, this test. And it's no wonder. It is no wonder because so many of these diseases out here are lifestyle based diseases. They are illnesses that are taking out entire families. They are generational. And that's where so much of my work lies, and why when I got this assignment, I really started thinking about the why behind my business. And I had always kind of known, but it was really hard for me to put into words still. I had never really figured that out. And then I really looked at myself and my own health transformation, my own health journey, and how the two really collided, how they coincided. And I'll share a little bit about the why behind my business and why I do what I do, because I worked for so long in healthcare. Like I've been in healthcare like over 2 decades by now, like over half my life I've worked in healthcare. And the last decade or so, yeah, the last decade, I did all cardiac ICU and recovery. And it just kept getting to me, the frequent flyers that we had. So people that come in all the time, we see them, repeat customers, okay? And we would see them all the time in the ICU. And they kept coming in with the same conditions, same complications from type 2 diabetes, from respiratory conditions, from obesity, from high blood pressure. And I mean, granted, we were on a cardiac unit, but during that time that I worked, I got floated all over the hospital, and those conditions, you see them all over. They are so prevalent in all the floors in any specialty area you're going to go to. And so we kept seeing them come in over and over again with these conditions. And then I kept thinking, I kept taking it personal that these people kept coming in. And I kept thinking, what am I not doing in the 12 hours that I'm caring for these patients? What am I not doing or helping them with that they keep coming back with the same stuff? Like they were severely sick. People were intubating and putting on pressors, medications to keep their blood pressures up, and putting all these horrible lines and tubes in them and doing all these terrible things. I'm like, why do these people keep coming back for this? Why? Like, what am I not doing? How am I not helping them? Where am I failing them? That's legit how I felt. And then I finally just one day opened my eyes and really just started looking at the situations that were occurring. And I will never forget the mom that I saw, some like really young 30-year-old mom, FaceTiming her daughter, her little baby girl, like 3 years old, because I could hear the voice while they were video chatting in there one night before she was getting ready to go to surgery because she had a blockage in her heart and needed to go get, she had to go get a heart catheterization. I wanted to say rotor-rooter. It doesn't sound very good, but that's exactly what we're doing. She had to go have a heart cath done the next morning. And she was having that video chat with her little baby girl the night before surgery because she was afraid she was never going to wake up from the surgery. And that was a very real risk complication of this procedure that she was going to have. But her condition, the reason why she was there was because she was severely overweight. Her lifestyle was terrible, smoking, drinking, all the things. Her weight was elevated, blood pressure. She hadn't gone to see the doctor in I don't know how long, wasn't taking any medications. She was in terrible shape, but it was because of a lifestyle thing. And I'll never forget that. I'll never forget that. And then seeing families come visit, family members in the ICU. And, I've worked at various ICUs over the years, and some had more lax visitation than others. So some, little kids could come see in the ICU. And I kept seeing like the little kids, little ones, eating chips, drinking, overweight. Then I saw kind of like the teenager and the teenagers really overweight on their tablets, not really engaging, not really doing shit. Then I see the adults. The adults are all overweight, and the adults are all talking about how they got type 2 diabetes and high blood pressure and how their hips and their back and their neck hurts and how they can't sleep and how they can't breathe and how they got this, that, and going on. And then I see the patient, and the patient is in the same situation. And it was like, and it dawned on me, like, we are creating this generation, this level of sickness, we are just continuing this in our families. And it's just taking out entire families. And then I looked at my own family. And the same thing. I was headed in the same direction. I was severely overweight, pre-diabetic, high blood pressure, and depression, anxiety, multiple medications, going into heart failure. Like I was fucked up. I was really sick. And then when I looked at the rest of my family, I was just literally following along in the same pattern as everybody else, as every other person in my family. And then I thought about my dad. My dad passed away at a very early age, his early 50s, from complications of type 2 diabetes, high blood pressure, obesity, had a heart attack, had a stroke, couldn't take care of himself, didn't take care of himself, smoking, drinking, all the things. And he paid the price. And it's the trauma from that, not necessarily from if you don't experience that exact illness, that exact sickness, but it's the trauma and the stress and the anxiety that it causes, the burden that it causes to the family members. So that's another thing that we have to consider when we're thinking about this environment and this generational cycle of illness and of sickness. It's because we're exposing these very young children or very young people to an environment that is not entirely normal. And so the shit that I saw growing up was definitely not normal. It's not normal to see people in and out of the hospital, right? It's not normal to see people poking their fingers or injecting needles into themselves, seeing high blood sugars, low blood sugars, seeing open wounds, infections, seeing amputations. Like that stuff is not the norm. And exposing young people to that, that's a normal type of environment so that as they grow up, seeing people like that is normal to them, when in actuality it is the abnormal. And so much of the abnormal has become normal nowadays, and we're normalizing this type of lifestyle that is causing so much sickness and really killing us, killing people, killing families. And it is so scary. And when I think back about seeing, the little kids to the teenagers to the adults in ICUs visiting family members, it's like you can see their future right in front of them. And it's like, why the fuck can't anybody else see this. Am I the only one seeing this? I know I'm not the only one seeing this. Like, who else is fucking noticing this shit? The little kids are going to turn into this, that is going to turn into that person in the bed. They're going to turn into that person that is in the ICU if they don't change it. And somebody needs to step in and make a change there. And it can be you. You can defy the odds. You can break the cycle. I did that for myself in my family. I could not have lived with myself when I started getting really sick like that. And I was like, holy shit, what am I doing? Like, I only had, at that time, I had a 3-year-old, like a 3-year-old and 1-year-old when my dad was sick. And I was like, oh my God. And that still even wasn't that much of a wake up call as to when I had my son, who's now 5, and I went into heart failure after I had him. And I was like, oh my God, Alex, what the fuck? Like, you're going to end up in the ICU, and then your kids are going to have to come visit you in the ICU. They're going to be fucking traumatized and scarred from that shit. What are you doing? That was the realization that I had to come to. And I know that together we can break the cycle. We can defy the odds. And that's why I'm so passionate about the work that I do, because I've seen this shit. I've lived it. So can nobody tell me that I don't know what I'm talking about, because it is a lived experience for me. I speak from my own experience, my own over 20 years of caring for patients in the healthcare system, from my own personal experience, my own life lived experience. So that's how I can speak to all of this and say the things that I do. And sometimes the shit I might say might trigger people, might not make people too happy, but it's the truth. It is the actual factual truth of what we're doing to each other. And we know for a fact that that people of color, that minorities are disproportionately affected by high blood pressure, type 2 diabetes, chronic kidney disease, dialysis. Like, it's killing us as a people. And my aim is to just end that shit. There is so much we can do based around lifestyle. It's all around lifestyle. It's what we're doing at home. That's the big fucking aha moment I had, was that we need to be educating and teaching these people at home how they live their day to day, because there's nothing that I could have done for these people in the 12 hours. I could just keep them alive. And that was it. That's all I was doing, was keeping people fucking alive. That's not a life, though. And I want people to be living life, to be loving life, to be being something. So that's my that's my big why behind what I do and why I do it. And I know that if you're watching this and this is like the first time you're seeing one of my videos or anything like that, but I know that I'm not the only one. And I know you might be watching this and you've either lived a life very similar to mine, or you have lived my life. I know I'm not the only one. And that you know exactly what I'm talking about and exactly how I feel. And that's why I make these videos and share these messages, because I know I'm not the only one. And I know that if you've been trying to get your health back and get your life under control, and you feel like nobody understands what I'm going through, I have so many stressors and so much shit going on in my life that I'm never going to be able to get it together. No, it is possible. I'm proof of it. And that's why there's proof all around you. You just have to open your eyes to it and have somebody guide you and make you aware that it is possible. It is possible. That's why I make these videos. It is possible. There is life on the other side of all of that. You just need to tap into the why, because that why is going to be strong enough to totally change how you approach each and every single thing that you do. Because there's lots of tricks and tactics and strategies and this and that, whatever you want to call it, tips, whatever. I can give you all of those. I will gladly give you all of those. But until you know the why, until you know the deeper reason of why you're doing what you're doing and how it's going to change your life, how it's going to change your family's life, how it's going to change your community, your business, your organization, then you can just keep doing all the things, but it's not really going to get you anywhere. Just like that guy sang that song. He could sing. He sang the song. Did it really touch anybody? Did it really change anybody's life the first time he sang it? No. But the second time he sang that song, he changed so many people's lives. He had people fucking crying. That is an emotional shift. That is an emotional change. All because you know your why. That can entirely change your life. So really think about the why when you're making your New Year's resolutions or whatever it is that you want to do. Because again, you don't have to wait till New Year's Day to decide. After you watch this video, you can really think about your why and decide to change your life right after you watch this video. It will change everything for you. It will shift everything inside of you once you can really tap into that. And again, you can apply this to your health, your life, your business, your career, whatever it is, your family, just knowing the why, really tapping into it. And it can be so difficult because you're tapping into trauma and you're tapping into past experiences and you're tapping into shit that you don't want to accept about yourself. Well, you got to. That's the only way you can process things and move past, because the past is the past. You can't do shit about it. All you can do is about this moment right now and what you do next. That's all you can really worry about. So I encourage you, take this time, really think about your why. And my DMs are open for people who know their why. You know your why. You're ready to get to work. You know what's up. You know how to get in touch with me. Message me. I keep everything private. It's a private message. So feel free to share whatever it is that you want to share with me. And if you're ready to get started on changing your health and really working with a provider, a professional, an expert that can help you turn your health around and get you going before the new year starts. I mean, because like I said, your body don't know it's a new year. We take people take every moment for granted. You never know when it's your next breath, your next moment. You never know. You really never know. And I'm not saying that shit to be fucking dramatic, because I have seen that my entire career. So it's my invitation to you. If you're ready and you want to work together, let's go. Right? You know where to find me. But that is today's episode. Let me know below your aha moments or what you took away from today's video. I know it was a little bit longer, but it's definitely something that is super powerful that can change your life. It's very simple. What is your why behind what you're doing? What is the why? Tap into that. Get to know it. Write it out. Talk to somebody about it. It will change your life. Okay? All right, guys. That is my video for today. And my voice held out to the very end. So, like I always say, excuse me, caramba. Ay, chihuahua. Okay, guys, like I always say, for a balanced life, just add spice. I'll talk to you mañana. Bye.